Okay, so this video is going to be talking about habituation exercises. With habituation, we're no longer focused on gaze stability. What we're worried about is if people have motion sensitivity. So if they themselves are moving, when their head is moving, that can provoke nausea, dizziness type symptoms. Or if optic flow, like things moving around them, they can have visual motion sensitivity. And so all habituation exercises is a way for us to try to desensitize your brain's response to that vestibular input or that ocular input that you're getting from your environment. So one tool that you can use for physical motion sensitivity is this motion sensitivity quotient. And so this test, you can see listed here are a bunch of different position changes that you can take your patient through to see if that provokes any of their symptoms. So there are things like head turns, laying down, sitting up, nose to knee, etc. And as you go through that, you can also just listen to your patient's complaints. And once you do your screening and you determine what motions are provoking, you can select a couple of those activities to have your patient do as a home program to try to desensitize their brain's response to those motions. So for example, if Tina was provoked just by turning her head side to side twice, then I could say, okay, Tina, what we're going to do is I'm going to have you turn your head side to side 2 times. 1, 1, 2, 2. I'm going to stop, wait for those symptoms to completely go away. I'm going to add 30 seconds. That's 1 repetition. I'm going to have you do 3 to 5 of those in 1 sitting, and we're going to do that 2 to 3 times a day. Okay, so that would be an example of what your prescription could be if that was a provoking movement for her. It's important that you're having them stop, wait for the symptoms to return to their baseline before you have them do another one, because that helps your brain learn that these are not threatening motions and helps desensitize your brain's response. So that's the concept of habituation exercises. They can be any motions. Sometimes it's people watching things on a screen, like trains passing by or being passed in a car. You can do all sorts of things for habituation, but the whole idea is that you're trying to desensitize your brain's response. And again, this is separate from gaze stability exercises.